Hi, in this video I will be talking about necrosis in a very easy way through examples so that all of the topic is covered. So first of all, you should know the various types of necrosis. So first type is coagulative. Alright, now in coagulative, you need to know the reason, like what happens is the denaturation of proteins. Then example, it is seen in solid organs, heart, liver, kidney. Okay, then second is liquefactive. Now liquefactive is due to lysosomal permeability plus hydrolytic enzymes. Okay, now here you have to remember the example of brain and infection. Okay, then third is caseous necrosis. Now caseous necrosis is coagulative plus liquefactive, and it is seen in TB, syphilis, histoplasmosis, coccidioidomycosis. Then third one is fat necrosis. Now this is seen due to the saponification of fat. Example, it is seen in breasts, and it is also seen in most common example, acute pancreatitis. Then last type is fibrinoid. Now fibrinoid, you have to remember, it is due to fibrin, like in this what you see is fibrin plus Ig immunoglobulin complex. Here example is polyarthritis nodosa, SLE, then malignant hypertension. Now I'll just enlist some of the most important things you should know. See, in necrosis you see a smear on DNA electrophoresis. But if you talk about apoptosis, you see step ladder pattern. Okay, then in coagulative necrosis, you should know the keyword. It is tombstone appearance of the cells. Okay, then here in fibrinoid, you should know that what happens is there are pink amorphous homogeneous cells plus normal surrounding caterpillar cells. Now let's just talk about, just give me a second. Yeah, we should go through the histopath as well. Just give me a second. Yeah, so let's just go through few tables so that we know we have done all that is needed. So I'll just, so see, these are the types of necrosis. Now here you need to know few things. Caseous necrosis, you need to know that they basically form granulomas. So these granulomas can be cacheating or they can be non-cacheating. Now you need to know the example sometimes. So TB, syphilis, all are cacheating. Crohn's disease is non-cacheating. See, fibrinoid, see amorphous mass, right, and normal. See, you will see this eosinophilic dense mass. Liquefaction and coagulative, you can see for yourself. Then let's talk about this one. So see, coagulative necrosis is due to ischemia mostly. All right, so due to ischemia. Liquefactive is due to digestion of the dead cells, as I told you, hydrolytic enzymes. Pale area, ठीक है, ghost outline, see tombstone appearance, I told you, so tombstone, see coagulative, yeah. Then caseous TB, cheesy necrosis, right, TB, then defective brain, myocardial infarction, and so on. Then this table, I think this is better one. So see, coagulative necrosis occurs due to hypoxia, all right, and it is pale in color. Then later turns into occult absence of nuclei, ghost cells, tombstone cells, all right. Then this can occur to severe trauma, toxin, and this usually happens in ischemic organs other than the brain. Inflammatory cell infiltrate is present. See, tissue structure remains intact. That is why we have the tombstone appearance. Okay, then hypoxia, liquefactive necrosis, same thing, but it occurs in brain and due to fungal infections. In this, numerous macrophages, necrotic debris, gliosis. Gummatous necrosis, this is due to spirochetal. So this is basically tertiary syphilis, right? Gamma. So in this also we have coagulative necrosis, hyaline deposition, giant cells, fibroblastic ring, and so on. Then hemorrhagic necrosis, cacheating. Cacheating, you have TB and some fungal infections, cheese-like appearance, amorphous necrotic center, fibroblastic rings, loss of architecture. Fatty necrosis is due to lipases and adiposes, acute pancreatitis and breast tissue necrosis, and we see it out at giant cells. This is important. See, this appearance is the Tauten giant cell appearance. This is also asked as a IBQ. Alright. So yeah. So this covers the topic of necrosis. If you like the video, do subscribe to my channel. Thanks for watching.